Hello everybody. This is my HD video where I'm gonna talk about all the HD related stuff in my life. Yes, HD is a neurological disease. We all have something called CAG-repeats in the Huntington gene, but those of us with HD have more. Um, and so like the symptoms I have are I have what we call chorea, which is the movement. I also have like speech issues. I have done like speech therapy for that, but if my words like drag or change or the tone changes from loud to soft, that's like part of my issue. Um, and so like just give me like peace with that. It's not anything I can control, and so I try to keep from doing it, but it happens, especially when you get tired. Um, and I'm like, do I basically stay tired? Um, so yeah. I also have issues with sleep. I can't sleep unless I take medicine. Um, and I have like balance issues where I fall a lot. Um, so right now I do have bruises from me falling like last week. Um, I have like memory issues, and whenever like I remember something, it does not always like come to my like it's in my brain, but I have trouble like saying it. So if like I just like randomly can't think of a word, I'll try to, like go around the word, try to explain it to someone um, in a way that they'll understand what I'm trying to say. Um, I know I did that yesterday with the first video I did that I did not post because I had trouble remembering something I was talking about in the first video. Um, so yeah. I also have an issue where I clear my throat a lot. Um, I try to, keep. I'll try to keep from doing that when I'm doing videos. But it's hard sometimes. Let's see here. Oh, oh, yeah. So like HD just really, really affects everyday life. And the reason I started to do this is since I got diagnosed, I've kind of just been, and I don't give a crap about whether or not um, people like me and all that. You know, if I don't have like space for you or time for you, I'm not gonna bother. And because like I know there is, we are all are gonna die, but like I just kind of feel like I have a ticking time bomb. And so, just have a I don't give a fuck attitude now. Um, so, like, treatments that I do. Oh, yes, I also have, like, emotional issues of depression and anxiety. Because I have, like, CPTSD, which is complex post traumatic stress disorder. I'm not going to go into exactly why I have that, but if I like skip videos or things like that, I'm gonna try not to, but I do have like mental health issues. Okay. Um, and the HD thing just kind of adds on to that, because it's more common for us to commit suicide because we don't want to live with all the crap we have to live with. Um, so yes, the treatments I'm on for my HD is take sleep meds and okay, sleep meds. And I take a medicine called Aestheta for Korea. Um, so there is a lot of research into like trials, like drug trials, and like observational trials, where they try to observe how like we do, you know, whether it's like progression of like cognitive stuff, like if you do like one like observational trial like 1 year and then you do it the next year and keep on going, it shows them like the progression of you. And so, we try to, well, they try to, like get as many data points as they can so it helps with treatment. But there's a lot of drug trials going on right now. There is no cure for it yet. So yes. Also, like with HD, it is a fatal disease. And so, yeah, we, just have to live with it. And how I got it, um, I was adopted, and so I didn't know, like, my family history of anything. So, um, my, like, since I didn't know my family history, I didn't get diagnosed until last year. Um, so, it's been over a year, and in February, it'll be 2 years. Um, so yes. Oh, and so like my bio mom and my bio grandmother have it. My bio grandmother died from it. Um, and so yes, it does not pass like it does not skip generations. And so like I'm not going to have kids, but if I did, uh, if my kid does not have it, then it ends for my line. But it's a 50-50 chance of them having it. And so, like with all the health things I had to deal with, along with, the pregnancy thing and all that, I don't want to, like, you can, okay, you can, have, like, IVF where they, like, get rid of the, like, negative, like, gene babies or embryos. Um, if you don't want if you want to go that way. Um, but it's more expensive than regular IVF. I do know one person, well, one couple who's thinking about doing that, but they pushed that back because her husband is going through a trial. um, yeah, so, uh, I'm in like a couple of support groups. I have like my main support group that I do every week. Um, I, it's through like Vanderbilt University. They have it's a HD clinic there. I do have a HD doctor here in the Memphis area where I live. Um, and my other support group that kind of got me into this whole thing is my game over group where I am a game lead. And so, like, every Monday, I run my, like, cozy game corner where I play lots and lots of cozy games, which, is basically what my channel is here. You know, cozy games and HD. Um, yeah, I think that's about it. So, if you have any questions, just leave them in the comments and like and subscribe to my videos. Um, so, I appreciate the love. Um, and I will talk to you tomorrow. Bye, guys.